interactions. Now, you'll probably think of this first and foremost as a task that the pharmacist will look for, and you'd be correct. But you need to be aware of several different drug interactions or types of drug interactions. I'm not looking for you to know necessarily that one drug interacts with another. I want you to know some of these broad categories. You will be expected to know a few small drug interactions that are more common. We'll start out with just mentioning the different types of drug interactions that there are. And these are a drug-disease interaction, a drug-drug interaction, a drug dietary supplement interaction, a drug over-the-counter interaction, a drug laboratory interaction, and also a drug nutrient interaction. So you can see there's several different types of drug interactions. It isn't always drug-drug, which is the one we usually think of. We'll start with talking about drug-disease interaction, and this occurs when a medication has the potential to make a pre-existing disease worse than before. An example might be something like you have a history of falls, and next thing you know, we're looking to give Xanax or alprazolam. And if you know anything about Xanax or alprazolam, it tends to make people a little slower to react, a little lethargic, and you can imagine if you're starting to fall and you're slower to react, that is definitely an issue. So history of falls, let's say they have Alzheimer's disease or some sort of Parkinson's disease that may, something that may make movement not quite as fluid. This could be an issue if you're taking something that might make you a little more sedated. How about a drug-drug interaction? Again, this is the hallmark type of interaction that people think of when they think of drug interactions. And this is one drug affects the activity of another drug. This can enhance or even negate another drug's effects. And this might be an example like aspirin and then warfarin. Remember, warfarin, or the other name for it, Coumadin, those are both blood thinners, as can aspirin be a blood thinner as well. It's not just a pain reliever. Taking together may be something that is an interaction. Maybe the patient is taking it merely for the pain control and they don't realize that it also has blood thinning properties. Next thing you know, they're bleeding very easily, gums bleeding, nose bleeding, that sort of thing, and that's because of the drug-drug interaction between those two medications. Next, we'll talk about a drug dietary supplement interaction. This is an example of a supplement that affects the activity of another drug. We'll start with the example of like St. John's wort. It's usually used for mild depression, and it can just be purchased over the counter. Secondly, birth control. St. John's wort and birth control have been mildly shown in studies to interact with each other. The problem here is maybe someone is taking St. John's wort for depression, yet it's keeping their birth control from being 100%, or I should say, 99.9% effective. That obviously can be a problem if a parent or a would-be parent is not looking to have a child and then has a child merely because they were trying to take a supplement for their depression. Next up is drug laboratory interaction, and many technicians aren't aware that this can happen. The one time that people seem to be aware of it, or at least they hear of it, is whenever someone talks about a drug test for a pre-employment screening, and they hear that they get a positive result, and next thing you know, they're like, oh, it must have been something I ate, or it must have been another medication I took that gave it a false positive, that made it look like I was taking a illicit drug when really I wasn't. And whether that's really the case or not, that's definitely the time when you think of a drug laboratory interaction. But this is, medication administered can affect a laboratory test. And as I already said, a false positive or a false negative. As an example, how about HCG? HCG, or human chorionic gonadotropin, is a drug that many people will take to lose weight. It's a certain diet that deals with a very low calorie diet where they take HCG and they lose weight. The problem is a pregnancy test looks for HCG in the urine. If you get a home pregnancy test and you're a young woman that is urinating on the pregnancy test, that is HCG, or human chorionic gonadotropin, that it is testing for. If you're injecting yourself with HCG or taking sublingual drops or any way of taking HCG for weight loss, there's a great chance you're going to interact with any type of pregnancy test that you're on. So those are just a few quick examples of drug interactions. I want you to be aware of them, the drug-drug, the drug supplement, drug over-the-counter. Just be able to identify that there's more than just a drug-drug interaction. Pay attention to them. If you ever suspect something might be going on, let the pharmacist know. I know I've had a few technicians that might come up to me and say, Stephen, did you notice she was pregnant? And no, I didn't, because sometimes my vantage point isn't where I can see that a young lady is pregnant. So you can help out the pharmacist sometimes by keeping your eyes open and realizing some things that maybe the pharmacist isn't going to be able to, because they're not as much on the front lines as you might be. So with that, study these, learn the different types of drug interactions.